Good day, everyone. Today's discussion will focus on a crucial topic for both nursing and healthcare: the communication processes, principles, and ethics. In the nursing field, clear and ethical communication is essential for delivering quality patient care. As nurses, it is our responsibility to ensure that patients understand their health and treatment plans while maintaining respect for their rights and dignity. Let's start with the key learnings from this course, which we will break down into three main areas: the communication processes, principles, and ethics.
Communication is a dynamic process that involves several stages: sender, message, encoding, channels, receiver, feedback, and context. Understanding this process helps nurses convey information effectively. We learn to recognize both verbal and non-verbal cues. For instance, a patient's body language or facial expression can provide insight into their feelings, even when words fall short.
In nursing, the sender, often the nurse, initiate communication, providing clear, accurate information to patients or team members. This role involves delivering instruction, educating or updating others on patient status, with an emphasis on clarity and empathy to avoid confusion.
The message contains the information that needs communicated, such as care instructions or health educations. For nursing students, crafting messages with attention to medical accuracy and patient comprehension is essential to ensure patient safety and adherence to care plans.
Encoding is the process of translating thoughts into words, tone, and gestures. Nurses learn to encode messages using language appropriate to the patient's literacy level, cultural background, and emotional state, allowing for more meaningful interactions.
The channel is the medium used to deliver the message, whether it is face-to-face, written, or electronic. Nursing students learn to choose the most effective channels based on the urgency and nature of the message, such as giving verbal instructions directly or documenting in a patient's chart for clarity and continuity of care.
The receiver, often the patient or team member, interprets the message. Nurses practice active listening and observe nonverbal cues to confirm understanding, ensuring that patients and colleagues correctly interpret information critical to their care or role.
Feedback allows the sender to verify that the message was understood correctly. Nursing students are trained to prompt and evaluate feedback by asking patients to repeat instruction or asking questions, enabling correction if needed and reinforcing patient understanding.
Context includes the physical, social, and emotional environment where communication occurs. Nursing students learn to adapt their communication based on settings. For example, a quiet room for sensitive discussions, and the patient's emotional state, enhancing the effectiveness and appropriateness of their communication.
Understanding and applying these components enable nursing students to navigate complex healthcare environments, fostering patient-centered.
Here are some general principles of effective communication that contributes to how can a nurse be more professional, especially in a workshop, to expand fellow nurses of their knowledge.
Nurses communicate to ensure patient safety, provide clear instructions, and coordinate care with the healthcare team. Being purposeful in communication helps nurses make informed, direct statements that support patient outcomes and reduce misunderstandings.
Know your audience. In nursing, the audience varies from patients and families to colleagues. Understanding the audience knowledge level and concerns allows nurses to use appropriate language, tone, and detail, improving rapport and fostering trust.
Know your topic. Nurses must be well informed about health topics and care plans to educate patients and answer questions accurately. Knowing the topic will enable nurses to provide credible and reliable information that empowers patients in their health management.
adjust your speech or writing to the context of the situation. Nursing involves adapting communication based on the patient's condition, cultural background, and emotional state. Tailoring communication to the situation enhances patient comfort, ensures understanding, and demonstrates empathy, which is critical in patient-centered care.
Work on the feedback given you. Nurses must listen to and act on feedback from patients, families, and colleagues. By integrating feedback, they can improve patient care, adjust communication styles, and continually develop as professionals in a dynamic healthcare environment.
Here are the principles of effective oral communication that can contribute to nursing and enhance the learning experiences in the nursing course.
In nursing, clarity in communication reduces risk of errors and ensures that instructions, health advice, or patient education are easily understood. Nursing students practice setting clear communication goals, especially when explaining complex medical terms in simpler language to patients.
Complete message help ensure no critical information is left out, which is crucial for patient care instruction and team coordination. Nursing students learn to include all relevant details, especially during handoffs or patient education, to provide comprehensive care and minimize misunderstanding.
Concise communication is essential in high-street healthcare environments. Nursing students are trained to get to the point quickly without leaving out necessary details, which help in a fast-paced situation when delivering instruction to patients or colleagues.
Authenticity in communication helps build patient trust and shows empathy. Nursing students develop their natural communication style to connect with patients genuinely, making patients feel comfortable and valued in their care process.
Specific immediately feedback is essential for patient care, whether in response to concerns or giving creativity guidance to colleagues. Nursing students practice timely feedback to ensure any issues are quickly addressed, supporting a proactive approach to healthcare settings.
Ethical communication is paramount in nursing. We discuss the importance of upholding patient confidentiality and privacy at all times. This builds the trust and ensures patients feel safe sharing sensitive information. We also examine cultural sensitivities. Being aware of and respecting diverse backgrounds allows us to communicate more effectively and provide care that is respectful and appropriate. A central ethical responsibility for nurses is to support patient autonomy and clear, respectful, and unbiased information sharing. This involves more than just presenting options. It means helping patients fully understand their choices, risks, and consequences. For example, being a surgical procedure, a nurse might ensure that a patient knows all their options, listens to any concerns, and support their financial decisions. With electronic health records and telehealth confidentiality is a growing ethical consideration. Nurses need to use secure systems, limit who access to sensitive information, and always discuss personal details privately. This responsibility reinforces patient trust as they know their information is protected. Moreover, observing confidentiality could guidelines help avoid legal risk and promotes a culture of ethical responsibility. Ethical communication goes hand in hand with cultural competence. Nurses should respect cultural preferences such as family involvement, dietary restrictions, and religious practices. Being culturally sensitive, nurses honor patients' values and beliefs, which can enhance the therapeutic relationships and improve compliance with treatment plans.
Now let's explore why effective communication is significant in nursing.
Trust is the foundation of any therapeutic relationship. When nurses communicate openly and honestly, it fosters an environment where patients feel comfortable discussing their concerns, leading to better health outcomes. Studies show that clear communication reduces the likelihood of errors. For example, miscommunication about medication can lead to severe consequences. By ensuring clarity, we enhance patient safety and overall care quality. Effective communication involves patients in their care. By discussing treatment options and listening to their preferences, we empower them to take an active role in their health, which often leads to better adherence to treatment plans. Empowering patients starts with clear, empathetic communication. Nurses who actively involve patients in discussions about their care make them feel valued and in control. This empowerment improves adherence to treatment and boosts overall patient satisfaction. For instance, a nurse discussing dietary changes with a patient with diabetes can encourage them to make healthy choices and provide resources to aid the transition. The importance of communication extends to reducing medical errors, especially during handovers between shifts or departments. For instance, standardized communication tools like SBAR, situation, background, assessment, recommendation, helps nurses deliver concise, relevant information, which reduces the likelihood of misinterpretation. Using such tools ensures continuity of care and safeguards patient safety.
Next, let's consider the direct impact of these communication principles on a nursing practice.
In today's healthcare environment, collaboration among professionals is essential. Effective communication ensures that all team members are on the same page, which leads to more coordinated and comprehensive patient care. Communication significantly influences patient satisfaction. When patients feel heard and understood, their overall experience improves. High satisfaction rates often correlate with better health outcomes and increased patients' loyalty. In critical situations, such as emergencies, clear communication can be life-saving. For example, when a patient's condition deteriorates, immediate and effective communication among the nursing team and other healthcare professionals is crucial to provide timely interventions. Effective communication builds a strong foundation of trust. When patients trust their healthcare providers, they are more likely to share critical information, follow care instructions, and feel secure in their treatment. Clear communication reduces errors, such as misunderstandings about medication or care instructions. This clarity can directly improve patient outcomes, safety, and adherence to treatment plans. When patients feel heard and understood, their overall experience with healthcare providers improve. High levels of patient satisfaction often correlate with better recovery rates and reduces hospital readmissions.
In conclusion, strong communication skills are foundational to nursing practice. They do not only enhance patients' satisfaction but also improve health outcomes. As future nurses, mastering these skills will enable us to provide compassionate and effective care. In nursing, effective communication is not just a skill, but a core component of compassionate and ethical care. By adhering these principles like clarity, active listening, empathy, cultural sensitivity, and respect for privacy, nurses foster trusting relationships and empower patients to participate in their own health journey. The impact of this communication skill is profound. They enhance patients' satisfaction, improve health outcomes, reduce medical errors, and strengthens collaboration within healthcare teams. As nurses continue to embrace these communication principles, they do not only contribute to safer and more effective patient care, but also reinforce the essential human connection at the heart of healthcare. Thank you for your attention, and I hope this presentation is highlighted to multiple importance of communication in our field.